Hello, I am Dr. Hariharan, diabetologist, khnursinghome, Chrompet. Today I am going to talk about diabetes mellitus. This is in connection with the World Diabetic Day, which falls on November 14th. During this month, we will be talking to you about various conditions about diabetes, enlighten you. Diabetes epidemiologically is the most worst scourge affecting the human society. About 10% of the human population and ever increasing. The increase is because of the radical change in the lifestyle, like an active life. Now it is a very inactive life with abundant food. India and China are the most phenotypically highest in diabetes. From time immemorial, our records say that ancient civilizations in India and China had diabetes, where the rest of the world were unknown. And this could be because of the genetic nature of the disease. Pathophysiologically, every cell in the body, trillions of them, depend on glucose for their energy. But if this content of the glucose in the cell goes up, it denatures proteins and they cause complications. The complications essentially are due to the denaturing of the epithelial cells or the blood vessels. So these complications are mentioned as microvascular complications and macrovascular complications. The eye, it is called retinopathy. The kidney, it is called nephropathy, and the nerves, it is called neuropathy. They are all microvascular complications. Macrovascular, stroke, heart attack, and foot ulcers. Diagnosis of the disease is very simple. A patient complaining of increased appetite, hunger, and passing too much urine or sudden loss of weight, you could conclude that he may be suffering from diabetes. Or a patient walking in a fat, obese person with a lot of diabetic markers, so-called pigmentation, can immediately say he can suspect diabetes. This can be confirmed by the gold standards over the world, GTT and HbA1c. Regarding treatment, treatment is simple because now there are, due to research happening across the world, lots of drugs have come. So, and now because of the government policy, the drugs, generic drugs have come at a much lower price which can be afforded by anybody. Regarding treatment, the doyen of diabetes, Sam G.P. Moses, said the concepts of treatment of diabetes can be compared to a table with 4 legs and a tabletop. One leg is exercise. Exercise is the most important. You have to walk. Walking itself reduces the blood sugar. If not, you can run, you can cycle, you can do elliptical, or you can swim. But this is imperative that this is done. The unfortunate people who cannot walk, then the control could be little poorer, especially the elderly. Number 2 is diet. Diet, the cardinal principles of control of diabetes is avoiding 3 S's: sugar, sweets, and soft drinks. If you cut them, 40% of the intake of sugar comes down. The rest, other 3 are using fruits, vegetables, and nuts, which themselves reduce the blood sugar. More than what to take, when to take is very important. Breakfast morning about 8 o'clock, lunch at 1 o'clock, and dinner at 7 o'clock. This is very important to control the counter hormones which are responsible for increasing the blood sugar. This has been known now to the world. So everybody is converging to breakfast, which is supposed to be now the brain food. And lunch could be fruit. Breakfast, you can, the saying goes that you have to do breakfast like a king. You have to take lunch like a commoner and dine like a pauper. This holds good for diabetes. breakfast, lunch and dinner you can take other cereals like wheat etc. about 7:30 in the night. The third leg is medicines. As already I have mentioned, there are plenty of medicines available and that has to be prescribed and decided by the doctor. Never self-treatment in diabetes is discouraged, because in knowledge which is accrued here and there or through Google may be totally incomplete and you will land in low sugar. And insulin, of course, the fourth leg is insulin. That of course is decided exclusively by the doctor, but some people require insulin for the rest of their life. Unlike in type 1 diabetes, all this we are talking about type 2, which is the commonest 95%. But type 1 diabetes is insulin dependent diabetes. Those people are dependent on insulin for life. We are not talking about that because that's quite uncommon. The tabletop is diabetic education, which we are trying to do now. Every opportunity we grab to tell the people something about the disease of which we have been doing. Please, you can contact us in khnursinghome.in or the media like YouTube, Facebook or Instagram. Thank you for the patient listening.